U.S. healthcare officials cautioned that without a miracle, this was a moment impossible to avoid.
The fact that a large number of our COVID hospitalizations are incidental really reflects the level of community spread of Omicron.
More than 147,000 Americans are in hospital, including 4,400 kids. It's a pandemic high, running headfirst into record-breaking case numbers.
We have hundreds of doctors and nurses now that have COVID and are isolating because of that.
I'm so sorry to be calling you like this.
And adding to the burnout for hospital staff, a death toll, which still hovers at 1,600 per day. The rampant spread of Omicron now prompting drug makers to act.
I don't know if we will need it. I don't know if and how it will be used, but we'll be ready.
Pfizer is set to produce 100 million doses of an Omicron-specific vaccine, unsure how long its booster protection lasts. The ever-changing messaging over vaccines has only worked to deepen political battles during this pandemic.
You are making a catastrophic epidemic for your political gain.
On Tuesday, health experts pushed back on personal attacks from elected officials while working to clean up criticism over evolving guidance.
This is the right guidance for what we currently know about transmission and the real-world circumstances we currently face.
Meanwhile, as the U.S. struggles to contain its outbreaks, Americans are now being advised to avoid traveling to Canada due to soaring cases, a move facing blowback from border town lawmakers, even with Canada already cautioning against all non-essential travel. CDC's decision to advise against travel to Canada is based solely on metrics, but even with the United States faring far worse than any other country on Earth, there's no appetite for new restrictions on domestic travel. Reggie Cecchini, Global News, Washington.